Once we have an appropriate diagnosis and we have placed the obstetric change also appropriately, look how we have two loops, one above the fetlock and one below. We're ready to start pulling. As mentioned before, for dystocia is best to have at least two people. One person will be assisting from closer to the cow and will be adding lubricant when necessary. And the other person will be pulling from the chains. So the person that is adding the lubricant and protecting the vulva as well will be the one leading as well and telling the other person when to pull, okay? So one of the principles we'll be talking about is when to pull, and when is that? When should we pull?
When the cow is having abdominal contractions is when you want to pull.
And that is very important because at this moment in stage 2, abdominal contractions are also in synchrony with uterine contractions. So if we pull at this time, we will be using the expulsive forces to our benefit. Another important principle is that we pull alternating limbs, especially with this type of dystocia. And that is because the widest part of the calf is at the level of the shoulders. So if you guys will have an abdominal contraction, how will you start pulling? Can you guys show?
I'm going to pull one leg first and pull the other limb until I get past the shoulders here out of the birth canal.
Okay. Once we are over there, if we have this type of dystocia, one risk that we have is that we could have a hip lock. That is when the hip of the calf gets locked with the hip of the cow. The biggest diameter from the hip of the cow is the vertical. So at this point, it's very important that we rotate the calf. So how would you guys start rotating the calf, and also at this point to follow the direction of the birth canal, which is another principle? Where would you guys start pulling, in which direction?
So to rotate the calf, we're going to cross the front feet. Alyssa is going to cross her chains, and I'm going to help by twisting. And then we're going to pull out as well as down. So she'll pull out, and I'll help push down. And the calf should come out.
Another type of dystocia we can have is an abnormal disposition, and that one occurs more frequently in cows. In this case, we have a calf that has a head back and a shoulder back, and basically this is how the hoof will look after the pelvic bone. So just for the purpose of showing how to correct this, I'm going to remove this, and Dr. Newcomer is going to be instructing the girls how to correct this abnormal disposition.
So anytime you have a malpresentation, a calf that's not in the correct position, obviously we have to correct the position. And so what Alyssa's going to do is she is palpating and she's going to correct the head back first. And so she's found the head. The important thing here is when you're moving the head is that those teeth are very sharp, and so they can lacerate or cut the uterus. And so she is going to cup her hand over the teeth and pull the head around to get that straightened out. Okay. Now that the head's straightened out, she has a little more room to work on the foot. And so she can reach back, and what she's going to try to do, this front leg is bent at the shoulder all the way back. So she's going to pull just from the upper limb to get the shoulder straightened out. And we're not really moving the foot at this time until she gets the shoulder where she wants it. And so what she's doing is just applying gentle traction, and now she's almost got that shoulder straightened out, caught there by the lower limb. And so now she's going to cup the hoof to again protect the uterine wall and get that foot all the way straightened out. And now we're back in our normal presentation, and she can put on her chains and pull the calf just like she would normally.